Welcome to Share, a podcast production of Amatus Recovery Centers. I'm your host, Kabir Singh. We like to start each program by reminding you that addiction is treatable and recovery is possible. If you or a loved one needs help, call 1-800-81-SOBER or visit amatusrecoverycenters.com today. Although it's gotten better over the years, stigma around addiction and mental health disorders still very much exists. Some believe that having substance abuse disorder or being anxious and depressed are still choices. That means they believe it's a simple decision to stop engaging in these behaviors. This notion is certainly far from the truth. And here to discuss what exactly is going on in the brain during addiction is Amatus Recovery Center's very own Vice President of Clinical Services, Avi Burstein. Thanks for being here, Avi.
My pleasure.
So a lot of folks, if listeners are out here, they haven't been a recipient of treatment services like I have. And as a recipient of services like that, I was certainly educated. That was part of my component of being in treatment. I was given these sort of, I think they called them didactic lectures and things like that. And I was introduced to a bunch of things there. And so let's maybe start with talking about addiction in a neurological sense. When someone has substance abuse disorder, again, for the listener, maybe in lay terms, what's going on in the brain?
Sure. There's a lot of things. I mean, the brain's very complex, but we've learned that addiction really happens with a large dopamine release. Dopamine's a pleasure chemical in our brain, and that gets flooded, right? Normally, if we release one element of that, right, when we take a substance, it releases 5 to 10 times that amount. So we're certainly flooding our brain with this neurotransmitter called dopamine that's making us feel really good. And so that in its own sense is not the addiction. Just taking one drug may not be the addiction, right? But over time, if you keep flooding your brain with that chemical dopamine by using drugs, eventually the neurotransmitter receptors that receive that dopamine become flooded and can no longer receive that much. It's so much that it has no idea what to do with it. So it's kind of like almost if you have a volume dial and you turn it down from 10 to 1, it can only receive so much of that dopamine. So what we're doing is we're taking more and more of that drug to sort of get back to that same dopamine level where we were feeling really good from it, and we can't get there anymore. So that's where, it starts switching from just that chemical release to that learning and behavior we keep trying to use and use and use to get back to that same place. I mean, the brain is really complicated. That's, I guess, a 30-second view of what's really happening, but it really has to do a lot with the chemicals. We used to think of addiction as more of a moral or a behavioral issue. It certainly has a chemical component to it. I would say that it probably has a behavior part to it also because it's a learned behavior as well, but you can't deny the fact that there's a chemical component going on.
Yeah, that I think that makes a lot of sense, and thank you for that sort of lens into 30-second snapshot as you mentioned it into the brain. My understanding about addictive substances are that generally different ones, crystal methadrenaline, as crystal meth as it's often called in the street, it releases massive amounts of dopamine, which I think over time are very difficult to replace and replenish. And I think that's part of the whole recovery process is really those first sort of months and days really in recovery and in recovery are difficult because the evening out of the mind and all the replacement of those. So when someone's ready to quit, heard about the stages of change.
Sure.
I'm as the listeners know, I'm a peer specialist, certified peer specialist in Maryland, and we certainly learn about the stages of change and contemplation, pre-contemplative. So when someone's ready to quit, maybe walk us through that a little bit in the lens of your level and the clinician status that you sit at.
Sure. I think, the stages of change are such a beautiful conceptualization of how change might happen, and knowing that it's a cycle, it's not a linear model, meaning that it can go in circle and people can go from any stage at any time. I think it's important to know that, like you mentioned, what happens when someone's ready to change. I think that, that's not the first part of the change cycle. Someone may not even think about changing, and there's still a stage of change. They're pre-contemplative at that point. And oftentimes you might see somebody come into a detox facility that may not want to stop using, but for whatever reason is still there.
Maybe they want to get out of the immediate throes.
Right, immediate throes, but they're not done with that drug, right? And so they might be in this contemplative, pre-contemplative stage of change where they're looking to change. So there's a few stages. One is pre-contemplative stage of change where the person's not even thinking about changing. Contemplative, where they had that idea that maybe I should change, but hasn't really done anything more than just thinking that might be an idea to have. And then there is preparation. So they thought that they want to stop, and now they're preparing to stop. They're taking some steps to prepare for that, but haven't really, I guess you can say, pull the trigger on making, that switch. There's action, where they're actually doing something about it, right? They made that life decision choice to do something about it.
Maybe they called our 800 number or one of our, outreach representatives.
Exactly.
Yeah, got it.
And then there is the maintenance, right? So nothing ever really, it's like anything in life. Nothing, you can't just set it and forget it. Maybe the old, infomercials like that, but you have to sort of keep at this in some way. Some people invest more time in their maintenance and some people invest less time, but it has to be maintained in some way. And then to complete the cycle, relapse, I believe, is always part of that stage of change. A lot of times people think of relapse as this negative thing. And relapse is just part of it, right? Most of the times there will be some sort of relapse. And, to be clear, to define it, it doesn't mean that someone used a drug as a relapse, but oftentimes the thinking might revert back to old kinds of thinking, or thinking that might lead down a path to using again. And that itself is a relapse, and that can be sort of checked often. And I think that's where a lot of self-help groups or fellowship groups really come into play, to sort of check that kind of thinking through a fellowship or through the programs or through therapy or through loved ones, to be open to that idea of being checked for that kind of thing. And so relapse is always part of it. It's always staying on this track. But, you mentioned before somebody calling our 1-800 number. They can be in the pre-contemplative, contemplative, or preparation or action stage when they call, right? I might call when I'm contemplating it, almost getting up to that point where I might take a preparatory step or an action step. But throughout those systems, people can move back and forth, and people can jump from contemplative to action. It doesn't have to follow a linear line. But it's a beautiful model because it allows people that opportunity to really see that the steps involved to it. It doesn't have to happen in one way, and relapse is part of it, but it also gives us the opportunity to really see someone as pre-contemplative, even though they're already engaged in some level of treatment.
So would it be safe to say that those out of all those stages, the most settled place to be would be in that maintenance stage, that you are? I'll go ahead and use myself as an example. And one of the things we're taught as peer specialists to use I statements. So I am part of a 12-step recovery community. I participate in that, and I have been so for nearly over a decade, really, at this point. So I consider myself, and you as a health professional, behavioral health and mental health professional, would you consider me to be in a maintenance? Mm-hmm. Okay.
Yeah, I think if you're working some sort of program, whether it's a 12-step program, self-help program, or
Celebrate Recovery,
religious program, whatever it is, if you're consciously maintaining the efforts you made to change, then you'd be in the maintenance stage.
Yeah. You brought up a very important point about relapse, because I remember there was all sorts of folks. Why doesn't he stop? He's so smart, or the worst one of them all. They've got so much potential, right? And so
it's all built up, all that kinetic energy.
Yeah, don't we know it? And so relapse being a part of it, it's important for the listener, I think, to understand here that if a loved one goes to an episode of care or treatment, and certainly time and resources, whatever that looks like, is spent on this individual, to know that it might not be the end of it, that there are people that take multiple attempts. It sounds like the way you describe the stages of change, there are folks that take multiple attempts at it. Do you know any particular stats behind how many times maybe somebody goes to treatment before? Is there anything?
I don't know any stat offhand that would say how many times it takes for someone to get in treatment. I think recovery is so personal. It's hard to say. You hear numbers being thrown around like it's an 80% success rate, but in treatment. But what does success mean? thinking about the stage of change, does it mean when they get from preparation to action, action to maintenance, pre-contemplative to contemplative? So in my mind, it's hard to really nail that down, and everybody's recovery is very personal. I mean, I know people that didn't work a program, didn't go to treatment, and stopped cold turkey, but they certainly have an addiction, and certain people need multiple attempts to get through, even from pre-contemplative to contemplative, or contemplative to preparation. So I try to steer clear of it. And when I talk to families about it, whatever mode of treatment you're thinking about, whether it's inpatient or outpatient, or even just fellowship work, just knowing that it's going to take time. It's you have stops and stalls, and it's always a bit of work to keep it going. So not necessarily a stat, but more along the lines of understanding it's a continuum.
So in the ways of treating substance abuse disorder, are there certain modes or methods that are more impactful than others?
Sure, I can speak. I mean, we know that there's evidence-based practices out there, that like cognitive behavioral therapy, which really takes the cognition piece, right? So it's the thinking part of our brain, and the behavior part, right? If we think of what we were talking about earlier about the chemicals in the brain, you have dopamine. It becomes a learning and behavioral kind of disease. And so CBT, cognitive behavioral, the thinking and the behavior piece approach to it, it's evidence-based. We know that it works. I would argue, in fact, that there are 12-step programs and self-help programs that are based, if you really look at it, it's doing that kind of work. It's looking at our thinking process and our behavior process, and works to change it. When I'm working with someone or families, I tend to sort of take a step back from that a little before we even get started, and really think about what their values are. And I don't mean like what their family values are, right? But what their own inherent values are, and what they're doing and why they're doing it, and try to find this gap between these inherent values that they have and their lives that they're living now, and try to build this, I guess you might call it a delta, like what's going on, or why is there a dissonance between what you really value and what you believe and what you're doing, without judgment, but trying to sort of put that out there and say like, hey, what's going on here? Let's talk about this. Let's think about that. And I find that to be the most impactful piece. I really find when you can get someone from pre-contemplative to contemplative to really build this desire to change, the rest you can build on after, but you need to build that foundation to really understand why you want to change. And I think that's often most impactful. When I've worked with people in this kind of area, in the stages of change model especially, I would often start my group or start my session saying, tell me why you're using, right? And people are like, well, I don't want to use anymore. And I would say, but there is something that you're using because of, right? It's doing something for you. Let's talk about what it's doing for you. Acknowledging that piece and figuring out, okay, if I know why you're using and you can own that piece that it's doing something for you, then we can work on why you might want to stop using. So taking that approach and kind of really getting at the foundation versus jumping in gung-ho and saying, okay, this is why you should stop. This is how we're going to make you stop. This is what you need. Trying to figure out and lay out that groundwork and that foundation first.
Yeah. So, sounds like just like anything else, a sturdy structure is built on a foundation, which is adequately there to withstand whatever's built upon it. And so that's a wonderful way of putting it for the listener, and I appreciate those particular details. Right now we're amidst a pandemic. There's certainly pronounced levels of overdose and suicide. Right now, are there different ways for folks to be addressing this particular, I know there's telehealth going on, and there's services that I know our organization has certainly pivoted into during lockdown times and the like. Is there anything that you have? Of course, there's the National Suicide Prevention Helpline, which has stellar people on the phone. But if you have any suggestions for anyone that surrounding that particular topic.
So there's been a lot of impact on communities, whether it's AA, NA, addiction recovery services, mental health services. We know that people are really struggling for connection right now. It's very unhuman-like to not be able to have that kind of connection, especially in times of need for people that are in recovery or have some sort of mental health condition that they're struggling with. I've worked with people that are struggling with connecting with their home groups or their NA groups or their SA groups, and I've worked with people that are struggling with maintaining their ability to connect with their therapist or group therapy, and within their own family support system. So I think the biggest thing that people need to be conscious of is people's support systems and people's aloneness and their loneliness right now and their lack of ability to connect. Even just walking down the street, you don't see as many people, or, giving someone a hug or a handshake is something that goes through your back of your mind. Like, is that okay? And it's scary for some people. Both the scariness of maybe getting sick, but also the scariness of being so disconnected from things. So while telehealth is something that will likely be here to stay, and there are benefits to it, if you think about people that are in rural counties that have to spend money to get into a clinic, just to drive and transport, and now the ability to just get in there right away from the comfort of your home, that's something that's here to stay, and it's going to be a great tool for patients and for individuals. But being conscious of people's separation from their communities, and when you meet with somebody and you know somebody who's that, reaching out and just giving them a call is something that's really, really impactful, and just letting them know that they're there, because their world might be turned upside down, especially someone who's in early recovery. Even in treatment, we would bring, H&I, hospital institution meetings into the facility. And then, before COVID, we would send people from the facility out to meetings to go find meetings in the area that they can sort of get into and get used to. And that doesn't exist anymore. So the whole, early recovery world is turned upside down right now. Yeah. You can't meet people on a Zoom platform or on a digital platform where you might be having a meeting. The fellowship's just not as strong in that sense.
This happened for me in my own life. I often think about the individual perhaps just leaving treatment, that back in 2009 when I was in treatment, that you did a good job, Kabir. Here's your certificate of completion. Mm-hmm. Go to a 12-step meeting this evening, and it was very, very simple. A lot of my family natural supports that had been put into place were there to, I had my brother, he drove me to meetings, just to, I think part of it was to make sure that I actually went. Mm-hmm. But in retrospect, it was a much easier time to get integrated. I was talking to some guys, young men that I mentor, and they're in early recovery. And the simple act of, again, my experience being mostly 12-step, is how do I ask somebody to be my sponsor on a Zoom format right now, right? Because you're asking in front of the entire group.
Right.
And so the dynamics of it have certainly changed.
Yeah. It's not like you can just walk up at the coffee urn at the end and saying, "Hey, I heard you talking. I want to chat with you on the side, get a sidebar." That doesn't exist anymore.
Yeah. So it sounds like there's a lot more required from the individual to really put forth effort and more deliberateness in the sense of it's gonna require a little bit more. Mm-hmm. Recently, within the last number of years, there's been a convergence, if you will, of mental health and substance abuse.
Sure.
They are starting to become a united force. There's language being used, comorbidity, and like it's in your experience, do you find them to be mutually exclusive, or?
No, not at all. Yeah. I mean, maybe a decade or so, the verbiage started changing from a dual diagnosis, meaning two mutually exclusive disorders, right? Two separate things that we have to treat separately. And it switched to co-occurring, meaning that they're happening at the same time. And I would argue that it's probably not even co-occurring. It's so intertwined, right? We know that, as we said earlier at the top of the program, that a drug will release a ton of dopamine, but that's not where the addiction starts. It starts on the behavior. But why did someone first take that drug, right? Do we know if there was a mental health disposition before that? We know that, maybe I think it was 40% of people have a genetic predisposition to using drugs. But it doesn't mean that they don't have a mental health disorder too. And I think, when someone's using, oftentimes there'll be a mental health disorder. Right? The whole Bible of mental health, the mental health disorders, the Diagnostics and Statistic Manual, lists all disorders as not otherwise due to a substance use disorder. So there is this interrelationship, and I would argue that we don't really know what came first, the chicken or the egg, with a lot of my patients, right? So I like to think of it as you're treating both. You can't really separate them. there will be stages of treatment. So if someone has a significant trauma history, in their early recovery, I'm not going to be really unpacking that trauma. We'll be talking about, coping skills for the effects of the trauma that someone experiences, and they're hypervigilant or not sleeping or things like that. But we're not going to unpack the trauma in their detox and maybe even the first 4 weeks of their treatment, because we want to make sure we're focusing on that piece. But it's always informed by their addiction or by their substance use. We want to make sure that we're always watching both play against each other oftentimes.
Wonderful. Well, Avi, thanks for being here. And there you have it, folks. That was Amatus Recovery Center's very own Vice President of Clinical Services, Avi Burstein. Hopefully you've learned a little bit about what's happening in the brain for those with substance abuse or mental health disorders, and you can use this knowledge in your very own life to help end the stigma. SHARE is a production of Amatus Recovery Centers. If you need help, call 1-800-81-SOBER or visit amatusrecoverycenters.com today. We look forward to seeing you next time.